We are continuing our coverage of the state's efforts to tackle the fentanyl crisis in Colorado. Many are watching the progress of a controversial bill at the state capitol, including already busy addiction treatment centers that could soon see an influx of patients. That's because it's part of the bill. Right now, it makes possession of small amounts of fentanyl a felony. It also allows for those caught with it to plead down to a misdemeanor and have their records sealed if they complete treatment. Karen Morfitt spoke to Denver Health about the potential impact of this on them. And Karen, they operate one of the busiest treatment clinics on the Front Range.
Yeah, Karen, treating 500 to 600 patients a day. They are watching this bill move through the legislature very closely, even testifying about the potential impacts it would have on their clinics. The director we spoke to today says they will certainly have to adjust should this bill pass, but he sees it as a good problem to have. Every week, Denver Health Center for Addiction Medicine is treating dozens of new clients.
There's pretty substantial, pretty robust process of assessing a patient.
Dr. Josh Bloom is the clinic's medical director.
It does create some bottlenecks and it makes it difficult to enroll huge numbers of people in short periods of time.
With that in mind, they're watching the discussion around fentanyl at the state capitol closely. A proposed bill would require those convicted of fentanyl-related charges to be assessed for addiction and in some cases treated.
To me, that says that it's very likely that if we don't have overt relationships with certain parts of the corrections community, we'll at least get people who are discharging from corrections. I anticipate that it would increase the likelihood we would have a lot of people showing up.
Brooke Bender, who also works at the Denver Health Clinic, is tasked with navigating those capacity concerns, specifically when it comes to residential treatment, where experts say the wait can be months long.
I think access is a huge issue, and so what we have established with Sobriety House is kind of a streamlined way of coordinating their care.
Both say regardless of the hurdles that will need to be cleared, it's something they're prepared to do.
I personally think that's a good problem to have if people are engaged in care and want it.
Now, the bill itself has a number of hurdles to clear on its own before this becomes a reality, but streamlining these services has been a priority of Denver Health's service center for a long time, even before this bill put fentanyl front and center. We're live tonight in Denver. Karen Morfitt covering Colorado First.